Good morning, everyone, and thank you so much for joining NYSARC's monthly webinar series, and welcome back to those of you who may have joined us for our January training. We're very excited about today's topic, where we'll be talking about preparing for Medicaid recertifications, which we expect will resume in 2023, and helping individuals make sure that they meet the financial eligibility requirements to be in compliance with their Medicaid eligibility, and managing some increases, a significant bump in the Social Security benefits for this year. Before we jump in, we just want to cover a couple of housekeeping items. Everybody is muted by default. We have lots of people on the line, so just to limit background noise, we have muted all attendees, and chat is disabled. We're encouraging you to please put any questions that you have into the Q&A. We will do our best to respond to those in real time as we can, and we will reserve the second half of today's program for open Q&A to go through those questions. We have enabled closed captioning for today's training. If you are on Zoom and you have the Zoom app open, you do need to turn on that feature to see those captions. We also want to remind everyone that the materials will be provided following the training. Zoom will send a follow-up email with a link to download these materials, so you don't need to request them or reach out to us. We will send them directly to you. And this webinar is being recorded. It will be available on our website. You cannot see anyone other than myself, the speaker view, and the slides. So no concerns there. You don't have to worry about turning your video on or off. The recording will simply be our slides and my video. And just a reminder to everyone that these presentations and these webinars are really for educational purposes. They do not replace sound legal advice. It's not to provide legal or financial advice to you, simply to help educate you on this process, what's coming, and try and give you guys some tools and solutions to assist individuals who may need to spend down funds in order to prepare for Medicaid recertifications in the future. So for those of you who work with individuals that receive Medicaid services, or if you yourself received Medicaid services, you're familiar with the process of having to renew your Medicaid coverage on an annual basis. Now, this requirement has been on pause during the ongoing pandemic. The state was essentially getting extra funding from the federal government due to the public health emergency. And in exchange for receiving that money, they agreed not to drop anyone from Medicaid coverage or reduce coverage that someone was receiving. Now, as of December 2023, the Consolidated Appropriations Act was enacted. And this is legislation that essentially delinked the Medicaid eligibility component from the public health emergency. So what that means is that regardless of whether or not the public health emergency is extended again later this year, Medicaid will be no longer required to continue coverage, meaning that individuals will have to go back to annually recertifying for benefits like they did before the pandemic. So understandably, this has advocates, concerned. It's been, many years since someone has had to submit a recertification to Medicaid. So we want to talk through what we know now about how they plan to begin this unwinding process, what the next steps will be, and how you can prepare for your recertification in the future. So it's important to note that everybody's coverage period is different. So it's all based on when you applied and began receiving coverage. So it's typically an annual basis, and they're going to start with coverage periods that end in June 30th of 2023. So if you have a coverage end date of June 30th, you will be among the first who need to renew their Medicaid for 2023. They have advised us that renewal packets will be sent out as early as March 1st for individuals who reside in New York City and receive Medicaid services through the Human Resource Administration. And in upstate counties, they'll be going out as early as April 1st. So that means those are the letters and the packets that they'll be sending out to Medicaid recipients providing them instructions and information about how to complete their renewal in a timely manner. So what can you do to prepare? The most important thing is being sure that you have up-to-date contact information with your local Department of Social Services or Human Resources Administration. If the county does not have the correct contact information, they're going to have difficulty reaching you. If you've moved, you need to update your address, make sure they have up-to-date phone numbers so that they can reach out to you if they're having difficulty contacting you. If you've moved to a new county, especially, you may no longer be receiving the services from your old county, but likely they didn't transfer you during the pandemic because they really didn't make any changes. So you would want to contact your old county and inform them that you are now living in a different county and they can work on assisting you with moving your case. Be on the lookout and respond quickly to any sort of mail or email from Medicaid informing you about when your renewal will be happening, when you are required to renew your coverage. And again, the reason why this is so important, making sure that you have your updated contact information, making sure that you're looking out for and responding to any notices from Medicaid, is that they're only going to have to required to make 2 attempts to locate a Medicaid applicant before they can discontinue coverage. So very important that if you have moved or any of your contact information has changed, that you update that with your local Department of Social Services so that they can reach you. And the next step is to make sure that you are in compliance with the financial eligibility requirements. If you're a Medicaid recipient and you have excess income where you're required to spend down your income each month in order to be eligible for services, you want to make sure that you've been paying that spend down and that you can, provide proof of those payments either to a plan like a pooled trust, special needs trust, or if you've been paying medical bills, just making sure that you have those receipts. We know that it's unlikely that Medicaid will require you to go back and provide that proof, but it is a possibility. So very important to just be sure that you are in fact meeting that requirement if you're able. However, it's important to note too that some individuals, due to complications that they had with COVID or their inability to meet a spend down during the COVID pandemic, may have stopped making those payments. And many individuals had coverage extended for long periods of time, again, due to the fact that Medicaid could not reduce anyone's coverage during this time. So it's really important that if you are in that situation that, that you do have some records that you can provide and that you look at resuming that payment if and when you're able. We also want to look at if somebody's, look at their accounts, look at the individuals that you serve to see if they came into any money or are accruing any funds that might put them over the resource limits. Here are a couple links to some resources that can help help walk you through this. These all come from the New York State Department of Health or Medicaid. There's a frequently asked questions, which really helps to go over and answer questions about Medicaid insurance during the public health emergency. A lot of this information is very helpful and relevant, but please note that it was last updated in July. So much of it is referring to the end of the public health emergency. And so just keep in mind that this is no longer the end of the public health emergency. This is 2023 when they begin Medicaid renewals, sending out packets as early as March and April. There's some information on the New York State Department of Health website about these changes, again, emphasizing the importance of updating your contact information. They provide you with resources on how to stay up to date so you know when your renewal is coming. And again, it's typically 1 year of that you're looking back to, renew that coverage. So it could be for the period of 2022 and 2023, depending on where you fall in that coverage area. And it could even go, back further. It all depends on when your Medicaid started. So if you have questions about when you're going to need to renew or for what period, we encourage you to contact your local Department of Social Services, and they'll be able to provide you with more information there. Now, before we continue and talk about what the financial eligibility requirements are for Medicaid for 2023 to ensure that you are in line with these limits going forward. Just want to take a quick moment to highlight that what we're speaking about today are individuals who receive Medicaid services and do their renewals through the local Department of Social Services, Human Resources Administration. These are typically individuals who are getting home and community-based long-term care services, like personal care services, who may be enrolled in a managed long-term care plan, aged, blind, and disabled individuals, or people who receive waiver programs, and any sort of community-based long-term care services. The SSI-related population, so individuals who receive any form of SSI or state supplement payments, and the Medicaid buy-in program. There is also other Medicaid. This is a program that is available to low-income individuals. I put some examples of the different categories that might receive Medicaid through the New York State of Health. That is very different. The eligibility for those programs are income-based only, and there's generally no resource test. They will complete renewals with the New York State of Health. So just when you're reviewing these things and you're reviewing the resources, be sure that you know that you're going to the right resource. You're renewing with the local Department of Social Services, HRA, and that's what we'll be focusing on today. Now, for anyone that joined us in January, you're aware already that Medicaid has made some significant changes for 2023 and has increased the income and resource limits for individuals with disabilities and adults who are over age 65, essentially expanding access to these services for thousands of individuals by allowing them to qualify when they have income that has been raised by about $600 a month, and the asset limits have almost doubled. So please note that these figures are slightly higher from the numbers that were presented in January, and that is because the New York State of Health has now adopted the 2023 federal poverty levels. So you see a slight increase from the 1563 that we presented earlier this year. And these limits are effective back to January 1, 2023. So we now have an even larger increase in income and resources that allow someone to be eligible for these programs. So if you're a single individual only receiving Medicaid services, okay, this is not someone who's getting SSI, but a person who is only receiving Medicaid services, you can have, as of 2023, January of 2023, $1,677 a month and be eligible for Medicaid benefits. If you have income that exceeds that amount, you would want to make sure that you're paying the appropriate amount towards your spend down, either by paying that money to Medicaid, using it on medical expenses and maintaining receipts for what you were spending those funds on, or depositing those funds into a vehicle like a special needs trust to maintain your ongoing eligibility for services. An individual can now have up to $30,000 in assets as well. So for individuals who may be looking at accounts to see if they're over the asset limit, this bump for 2023 might help cover you and mean that you don't have to spend down assets any longer. Now, those are the limits for a person that's applying, an individual that's applying on their own. We also have different budgeting if there's a married couple who both need care. And this is only in a situation where they're both receiving Medicaid services. They have a slightly higher income and asset limit. And then there's also a little bit more favorable budgeting if there is a married couple where only one of the spouses needs care. And that allows that spouse that does not need care, the community spouse, as we call it, to keep more in income and a little bit more in assets as well, leaving them with some resources so that they have funds to pay for their care in the future. And it's important to understand that deciding what budgeting option makes the most sense for you can be very complex. And it really does require, running the numbers and doing some cost benefit analysis. So anytime that you are a married couple and considering this, we do really strongly encourage you to work with a legal professional or someone who really thoroughly understands these rules and how to help you determine what budgeting option might be most favorable to you. Beyond that, we also have the Medicaid buy-in program. For individuals in the Medicaid buy-in program, their income limit is 250% of the federal poverty level, so much higher than a single individual just receiving Medicaid services who's not working. But they do have the same asset level as well. So if you're in the buy-in program, you want to make sure that you're compliant with those income and asset limits. Now, for most people, they should have been paying that spend down and they should be up to date on any sort of income. What we're really concerned, I think, mostly will be regarding people with excess resources. Those individuals who may have funds that are accruing because they maybe weren't able to go out and spend money as much during the pandemic, maybe not do the things that they would normally go out and do. And also just for people who may have come into a sum of money. As we know, there were many people that were affected by the pandemic, resulting in a lot of individuals receiving things like inheritances, additional benefits because a loved one, either or a parent, retired or or passed away during the pandemic. So if you have an individual who receives SSI services or any sort of state supplement payment, they are subject to the SSI resource limits. So even though they receive Medicaid services, they receive those Medicaid services on the basis of their SSI eligibility. And so they are subject to these much lower resource limits, meaning that a single person can never have more than $2,000 in their name and still qualify for these services. So that's going to be a lot of individuals that you may be working with who live in residential settings or who may receive SSI benefits and may have funds that they just have not spent that may need to be reduced in order to maintain their eligibility for services. And of course, if the person is only receiving the Medicaid benefits, no SSI, that would be where you'd look at those Medicaid or Medicaid buy-in resource limits to determine if they have funds that exceed those limits. And if you identify someone who is over the resource limits, we want, or over the income limit, we want to make sure that we're taking steps to get them in compliance with the financial eligibility requirements prior to their recertification. And keep in mind that Medicaid is a month-to-month program. So if you have funds that exceed that limit, you really do want to spend those down as quickly as possible to avoid having multiple months where someone may not have been eligible for services. So the first thing we're going to look at is how much money is it that this person is over the limit? And if it's just resources, is there something that we may be able to purchase for that person? Is there something that they want or need that might allow us to spend that money down quickly without them having to even go through setting up any sort of vehicle where they need to protect that money? So first thing we usually suggest is looking at funeral expenses. Has the person set up an irrevocable pre-need funeral arrangement? That can be a great way to spend down a chunk of money. What are some things that they like to do, or perhaps things that they may need for their room or apartment? Furniture, electronics. It's very individual to that person, but really want to try and sit down and think of, is there an appropriate way that we can spend this money so that we can get them down below the limits and make sure that they're eligible financially? If you've already gone through that and exhausted all those options, or sometimes it's just that the person would benefit from having that money available to them in the future and allow that to build up over time, they might consider using a vehicle like a special needs trust or an ABLE account. These are tools that were designed to help people with disabilities who receive means-tested government benefits like Medicaid and SSI be able to get money out of their own name and even have funds left to them from other individuals, family members, without it causing an interruption in their government benefits, without it causing them to lose or have those benefits reduced. A special needs trust is a standalone special needs trust is a special type of irrevocable trust. And again, it's designed to help a person with a disability You do need to have an attorney draft a document, and you need to select someone who will serve as the trustee to manage the assets in the trust on behalf of the person with a disability. A pooled trust is a special type of special needs trust, which is managed by a nonprofit organization. So it's does not necessarily require an attorney to draft a document. Those documents have already been drafted. You're simply applying to join a program, and a nonprofit organization is going to serve as the trustee. So that can provide some great benefits, and we'll go through that throughout today's discussion. And then ABLE accounts are another option for someone that has excess resources. ABLE accounts can be used to help someone reduce up to $17,000 a year in excess resources if the individual is eligible for an ABLE account, which at this time, the individual does have to have a disability, onset of disability prior to age 26 in order to participate in an ABLE program. So let's talk a little bit about these programs, give you a little bit more detail about what options you have and what are some of the key differences between these programs to help you decide what might be the best option in a person's situation. So special needs trusts are allowable. A lot of people ask questions, is this legal? Yes, this is entirely legal, and it is allowable under both federal and New York State statute. You do have to have a qualifying disability in order to use a special needs trust. And these trusts are irrevocable in order to protect a person's eligibility for benefits. If we could simply change the arrangement of the trust or give the person money out of the account, that wouldn't be considered protecting that money. It would be considered available to them. So the irrevocability of the trust is to give them that benefit of being able to still receive services despite having this money in a trust account. Special needs trusts allow individuals to protect their own income and assets in order to become financially eligible for services. And it can also allow people to protect other people's income and assets in a special needs trust for an individual's benefit. In addition to helping someone qualify for these services, really the main topic we're talking about today is in situations where people are already receiving these benefits and they want to avoid going over these financial limits to maintain their ongoing eligibility for services. And what's really the best benefit of a special needs trust, and the real whole purpose of this, is to allow someone to have a vehicle to move this money out of their name so it doesn't cause them to lose the vital services that they need through government benefits. And they have now a way to save some money for the future without causing an interruption in those benefits. Really allowing people to maybe allow funds to build up and be used over time, plan for maybe a goal that they have, like taking a class somewhere or going on a vacation, and allowing that to build up so that they have funds available for future wants and needs. A special needs trust is also unique in that the trustee, the role of the trustee is to oversee how those funds are being used, ensure that they're being used appropriately for the benefit of the trust beneficiary, and that they're being spent wisely to help those funds last as long as possible and provide the individual with the best quality of life possible. So that's, a huge benefit you have as a trustee. It can also be, a big responsibility. So we do want to just kind of review with you all what some of the considerations you might have when choosing a trustee of a special needs trust. So if an individual is eligible to draft their own special needs trust and they go to an attorney, they're going to need to select a person to serve as trustee. If it's a pooled trust, the trustee is the nonprofit organization. And this trustee has a fiduciary responsibility to manage the funds in the trust in a way that it will give the beneficiary access to funds that will supplement their government benefits. And we have to do the day-to-day management of the assets in the trust, distribute bills, and oversee regular communications with the beneficiary. Whoever you choose to select as the trustee has to be someone that is ready and willing and able to take on this role. You want to make sure that you're working with someone who understands the rules about your government benefits and will make appropriate distributions and know how those distributions could potentially have an impact on those benefits. So working with a pooled trust, you have a nonprofit that understands the rules of Medicaid and SSI and has decades of experience. Whereas with a family member, when you choose a family member, they may not have that background. Another thing to keep in mind when selecting family members is that even with some of the best relationships, that can put a real strain. Anytime money is involved, it can put a strain on that family relationship. So it can even benefit individuals that might have a good family structure to consider a professional trustee. That way, the sibling or the parent can still be an advocate for that person with the trust, but doesn't have to take on the legal responsibility of serving as trustee. So these are just important considerations when you're thinking about what options a person has. ABLE accounts are another option. These are modeled after the college savings accounts, and these are designed to help people set aside money for qualified disability expenses. So again, as I've noted, an ABLE account can protect only the resources. So if someone's over the resource limit, and this is from any source, so the individual's own money or money from a third party. Person must be disabled prior to age 26 to use this account. And there are some limits on how much you can put in and the maximum account balance, which we'll go into more detail on. It is the responsibility of the account holder to maintain and manage this account. So it can be good for a person that is financially savvy, can manage their own finances, or who might have an individual in their life that could be an authorized signer and assist them in managing this account. Now, do keep in mind when you're appointing someone to manage an account for someone, if it's a parent, who's going to manage that account when that parent is not there. So again, that's, one of the benefits that an SNT provides is that you have that trustee for life. It's important to note with ABLE accounts that there are many options out there. Some programs only work within residents of their state and others are national. So it's important to shop around and look at what option may be best for you. And this money does grow tax-free as long as it's being spent on qualified disability expenses. So what are the next steps to get started? If you want to set up a special needs trust, as we've discussed, it can be set up by the individual, parent, grandparent, or someone else with the legal authority to establish the trust on their behalf. You do need an attorney to draft a trust document, and this is only available to someone who has their own money if they're under the age of 65. Once you're over 65, you do need to use a pooled trust. Otherwise, the deposits into the trust could be counted as income to you. And with a special needs trust, when you do your own trust, you're going to need to select your own trustee, and there will be legal expenses to establish the trust and potentially trustee management fees if you're hiring a private trustee. With the pooled trust, it's similar. An individual can establish for themselves or any of those authorized representatives. This can be funded by someone at any age, even if they're over the age of 65. But keep in mind that if they receive SSI or if they may be going into a nursing home within 5 years, there could be transfer penalties to consider. So if you have someone over 65, we encourage you to contact a pooled trust and discuss their options before moving forward with an application. These, as I mentioned, trust documents are already drafted, so you don't necessarily need to work with an attorney, but we do encourage you to work with a legal professional. Many of these situations may require an attorney to be involved. These documents have already been approved by Medicaid and Social Security Administration, so you're simply filling out an application to join the program, and an account can be opened in about a week's time. So a pooled trust is a great option in these situations when someone needs to spend down funds quickly, because it can be opened very, in a short time and with a small minimum funding requirement. You can open an account with as little as $300 with NYSER, whereas an individual special needs trust may cost thousands of dollars to set up. In this trust, you don't need to select a trustee. You have the nonprofit that's serving as a trustee, and there's going to be a one-time enrollment fee and monthly fees for the trust to administer that account. And those will vary by different pooled trust programs. With the ABLE account, this is something that can be set up by the individual themselves or other authorized representatives. As we've stated, the onset of disability must be prior to age 26, and you can generally apply for these programs online or over the phone. The account holder is required to manage that account and hold on to all receipts so that they can justify that those payments were used for qualified disability expenses. So again, this is a good fit for someone that is willing and able to maintain that documentation and know the rules to understand how distributions from their ABLE account could impact their eligibility for benefits. And again, like pooled trusts, the fees will vary by program. A couple of other key differences between these options. Special needs trusts don't have any limit on annual contributions or account balances. There's no maximum that you can put into these accounts. Whereas the ABLE account, you can only deposit up to $17,000 a year, and that's from any source. So if I want to spend down some of my assets and my mother or a relative would like to contribute as well, between both of us, we can only contribute $17,000 a year. Person on SSI can never have their account exceed $100,000. Otherwise, any money above $100,000 will be counted as an available resource. And if a person is just receiving Medicaid, they have a $520,000 max balance in New York State for this year. Again, just to reiterate, an ABLE account can be used for resources, but not income, where an S&T can be used for income and resources. If someone's over 65, the income would have to go into a pooled trust. And there are Medicaid payback provisions, meaning that if you receive services through Medicaid and you put money into one of these accounts, that Medicaid expects to be repaid for the services that were provided to them upon the death of the Medicaid applicant. So in case of a special needs trust or a pooled trust, those would be subject to Medicaid payback. In a pooled trust, the funds are typically retained by a nonprofit organization and used to help other people with disabilities rather than the money going back to Medicaid. And with an ABLE account, any funds, including funds from a third party, will be subject to Medicaid payback. So that is one advantage of using a special needs trust. If you are a parent or a grandparent or any relative that wants to leave funds to a loved one that receives government benefits, an S&T might be a better option. So let's talk about a couple of examples real quick before we open up to questions. So here we have Joe. He's 45 years old and he lives in a residential setting. He's always loved going out to the movies and plays in his local bowling league. He usually does this a couple times a month, and he's never had any issues keeping his account below the limit. But after many months of not going to the movies and not going out to his bowling league during the pandemic, he's now finding that his personal funds have grown beyond the $2,000 limit. So when we're looking at what options we have for Joe, we want to consider how much over the limit he is. As we've talked about, we want to look at, are there ways that we can spend down this money? Is there an alternative, way to have him get the same entertainment, but, using different tools, like maybe buying a streaming service or, helping him set something up where he can rent movies and watch them from the comfort of his own room, or maybe even looking at electronics or, an iPad or maybe a video game console that might allow him to, still be active and, have hobbies and recreational opportunities. There's just so many things, that we may be able to do, that we just need to sit down and get creative and think about what this person wants or needs. We also want to think about if this is a one-time situation, or do we expect this to continue? If we expect it to continue, it may be better to look at an ABLE account or a pooled trust, for example, because you can offload these, small accruals of resources into an account that can give him a vehicle to save for the future. Jane, we've got receives SSI and Medicaid benefits, and she's under the age of 65. She's never had much issues with maintaining her eligibility for services, but during the pandemic, her grandmother passed away, and it was discovered that she received a significant sum of money from her grandmother's estate. So we want to look at again, how much, over the resource limit will she be? Because she receives SSI and can only have $2,000 in her name, it's likely that she'll be significantly over that resource limit. Because she's under the age of 65, she does have the option to go to an attorney and draft her own trust document if she has a family member or a trusted individual who might be willing and able to serve as the trustee of that supplemental needs trust. If she doesn't have that, or if the family might benefit from working with a professional trustee, another option might be a pooled trust. In our third example, we have Nathan. He's 67 years old and he's receiving Medicaid through the excess income program, meaning that his income on a monthly basis is over the financial limits to qualify for Medicaid services. Prior to the pandemic, he was paying that money directly to Medicaid to satisfy his spend down requirement. But he did have some complications with COVID, and he did stop paying his spend down at the beginning of the pandemic. So for many months, he has now had an accrual of funds in his bank account because he has not been sending that money to Medicaid. And he now has a large balance that needs to be spent down because he's over the resource limit to qualify for Medicaid services now. So in Nathan's case, we've got two potential considerations. We first need to look at how do we get the resources down, get him below the resource limit, make sure that he's compliant financially, but also consider ways to manage his excess income going forward. He can certainly resume payments to Medicaid, but now we see now that the significant sum of money that he could have had available to him to use for his living expenses and things that could improve his quality of life. So another option would be to start sending that spend down deposit to a trust. By doing that, and he would need to choose a pooled trust in his case, based on his age, he's now able to have a chunk of money that he's moved over to plan for future wants and needs. And each month his income is going into an account that he can use it for expenses. So this will give him a vehicle to save for the future and maybe plan to go on a trip or go see his favorite baseball team. Once we've decided that one of these accounts may be a good fit, it's helpful to know, what are some things that they can use it for. And in some of these instances, you might be looking for both of these tools. Maybe we put a small chunk of money into an ABLE account and the remaining balance into a special needs trust. These tools really complement each other very well because they provide different benefits and they can be used for different purchases. So ABLE accounts are primarily used for things that are related to a person's blindness or disability. So these qualified disability expenses. And they're very broad categories, as you can see listed here on the screen. And there's certainly some crossover, but they often provide options to pay for things that that potentially an S&T could not pay for. For example, someone on SSI in a special needs trust, we can't pay for food or housing, but an ABLE account could pay for those services. So again, having both of these tools can really maximize the benefits that a person can receive. And it's just important that when you're making distributions from an ABLE account, that they are for non-qualified expenses. If there are purchases out of the account that are not qualified, they may be taxable if the person is audited. So just something to keep in mind. You want to be sure that you're keeping detailed records and you can present proof of how the distribution from the ABLE account was for a disability-related expense. Now, a special needs trust can be used for most of those things and so much more. And there's not very many limitations on what the funds in the trust can be used for, other than that they must be used for the primary benefit of that person. So items and services in their name, purchases that go above and beyond what they receive from government benefits. The goal is to make sure they're receiving the full benefit of Medicaid and SSI services, and that we're only paying for things that go above and beyond that. Food and shelter, living expenses are all primary things that we use the trust to pay for. unless the person is receiving SSI, where food and shelter could potentially impact their eligibility for services. And beyond that, it's really about that person, what they may want or need. It can be used for things that are just purely quality of life enhancing, entertainment, recreational opportunities, cultural experiences, vacations, hobbies, summer camp, companionship services if they need someone to come and visit them, or maybe they want to go somewhere and need someone to accompany them. It can be for therapy services that aren't covered by Medicaid. If someone lives with a family member or in a community-based setting, we can set up rent so that they are paying for their living expenses in that home, as long as they're not receiving SSI benefits. So there's really an endless list of things that the trust can be used for, and we encourage you guys to get creative. But the important thing is that the trust buys you time to consider and plan for using these funds in a way that it will benefit the individual the most. Most common requests are bills where you're sending in a bill and asking for us to make a payment to a third party. It can also be someone buys something for the beneficiary and asks us to reimburse them. Using a credit card is a great way to go out and make purchases and then just send the credit card statement to the trust, and they'll pay you for, pay the credit card company for expenses. And in some cases, vacations, if someone's making a larger purchase, they might want to send that to the trust ahead of time, and the trust will work with them to make that purchase. So there's so many things that the trusts and ABLE accounts can be used for. And we really encourage individuals to consider utilizing these tools when they're able, to give individuals more funds available to them, more than just the benefits that they receive, so that we can help them have the best quality of life possible. So with that, I'm going to open things up to questions. And Nina, I'm going to have you unmute yourself and jump in here. Throwing some questions our way, but do want to remind everyone that our next webinar will be, again, the third Thursday of every month, March 16th at 11 a.m. And we'll be speaking about a third-party special needs trust. So geared towards parents, families that are looking to plan for a child with a disability, and particularly giving some updates regarding inherited retirement accounts, and some news about the Secure Act, which is great news for individuals who might be planning to leave retirement assets to a child with a disability. So with that, Nina, throw us our first question.
Okay, we have a couple questions about the stimulus checks. Are the funds from stimulus checks still exempt from the SSI limit?
Yes, so for Social Security Administration did change their policy regarding stimulus checks. So originally they had said that you had to spend them down within 12 months of receiving those funds. They changed that policy, and the Social Security Administration is no longer counting that money. Now, for how long, we don't really know. And there are some resources from Medicaid that still state that stimulus funds need to be spent down within the year. So from a Social Security Administration standpoint, no, you do not need to worry about stimulus funds being counted as income or a resource to someone. But I would advise you to reach out to Medicaid regarding any questions about the Medicaid eligibility.
We also have a couple questions about paying back monies that weren't paid over the pandemic. So if coverage has not been paid during the pandemic yet, client receives Medicaid benefits, does all back spend down monies need to be paid prior to recertification?
Such a great question. I want to caution people that the direction that we've received from Medicaid is that you are still required to be meeting your spend down requirement during the pandemic. They did provide easements for individuals that had a specific complication related to COVID. And then of course, coverage has been extended. So we feel it will be unlikely that they will go back and say, you need to show proof for this entire period, but it is possible. So if you have not been paying your spend down it would be a good idea to consider starting to pay it again. If you're just spending your income on expenses throughout the month, and that's how you're reducing your income, if they're not medical expenses, then you're not going to have that money if you owe a penalty to Medicaid. If you're putting that money into a vehicle like a special needs trust or a pooled trust, at least that money is there in the event that you do have money that's owed in the future. You could, potentially repay that from the funds that are in the trust. So we do encourage you to meet your spend down requirement. We do not know for sure whether or not Medicaid is going to go that far back. I think it would be unlikely, personally. It's a lot of people, as you can imagine, that they're going to be doing this for. So we are hopeful that they will, kind of pick up where we left off. But it's certainly possible. And again, I encourage you to take a look at the frequently asked questions that we provided in the resource. There is more information there, specifically question number 9. If you participate in the excess income program, it says that you must continue to, pay in by either sending the money to the local Department of Social Services or meet your obligation in some other way, like a pooled trust. It does mention that you would be required to resume submitting bills once the COVID public health emergency ends, or again, in this case, it will be once renewals restart.
What does the transition look like for someone who needed an S&T last year but no longer needs one?
So if someone is using an S&T for, I assume they're referring to like that they had a spend down and now because of the income increase, they no longer have one. In that case, you're simply calling the pooled trust or the trust that you're working with and stop sending any future deposits if you no longer have a spend down. And the trust will, in our program, we put you in what we call no longer participating, which releases any funds in your account, makes them available for you to spend. So you would want to stop sending any money to the trust going forward and spend down whatever money you have in the account as quickly as possible. You will be able to use any of that money during your lifetime. But like all trusts, upon your death, that trust closes. That's a federal policy. So you want to make sure you spend that money as quickly as possible.
We also have a couple questions about the look back. Is the look back still on hold for home nursing services? I wanted to make sure that there is no risk in transferring assets to a trust prior to recertification concerning the look back penalty. I know this has been on hold.
Yes, it is currently still on hold. The latest information we received is that the earliest that they could begin to implement a look back for community-based home care services or community-based personal care services. So again, this is specifically related to somebody who's getting home care services. That has been delayed, and the earliest they would be able to implement it, I believe, is March 31st of 2024. So we've got at least another year. And again, there's a possibility it could get delayed again, but that's the latest that we have.
We have a couple questions about ABLE accounts. So I'm going to group together some of these, Sarah, so hopefully you can answer all of these.
Awesome.
We have, can a person open more than one ABLE account? Is the limit still 100K? And are contributions to an ABLE account tax deductible?
Okay, so I'll start at the top. You cannot have more than one ABLE account. You can only have one ABLE account. So if you have an ABLE account and you move to another state and you want to open an ABLE account in the other state, they'll allow you to open a new one and transfer things over, but you can't maintain 2 ABLE accounts. There is still a $100,000 maximum account balance if a person receives SSI. Now, that doesn't mean that their account balance can't go over 100,000. It means that if it goes over 100,000, every dollar over the 100,000 is counted as an available resource. So if the person has no money in their bank account, once they reach 100,000 $102,000. Anything above that will put them over the resource limit. And then, I'm sorry, it was if the contributions are tax advantage?
Deductible.
Tax deductible. So, like college savings accounts, I believe the contributions are tax deductible. And also payments out of the trust. So very much like an HSA, like a health savings account. And the funds also grow tax-free as long as they are being spent on qualified disability expenses. If there are distributions that are not considered qualified disability expenses, those could be taxed.
Sarah, do you know where we can find the documentations where Social Security is stating that they are exempting the stimulus money? Someone wants to have that on file because they're running into some issues.
Oh, well, that's concerning. Yeah, I will look into that because I know that they did publish it at one point and we had a link to it that we were including in some of our resources. And shortly, a couple months back, I looked for it and the page no longer existed. So I will look to see if we can find out. And if you don't mind, maybe just sharing your contact information with us, and we'll reach out to you if there's if we're able to find something we can point you to. But yeah, that was very challenging, where many of us were trying to help people plan under the policy that these would be considered resources, and then they changed that policy kind of right there in the middle. So.
We have a question about how you can use the trust funds. Can someone take a vacation and pay for vacation expenses for using the trust funds?
Yes, everybody's situation is case by case, right? It comes down to what your wants and needs are, what your plans are for the trust in the future, how much money you have available. Are your basic needs being met? We're generally going to prioritize making sure that you have your rent paid and your utilities paid before we send you on a trip somewhere. But if you have funds available in your account and that's how you choose to spend them, yes, absolutely. We send people on vacations all the time. Is actually a member of our trust management team was mentioning this just this week, how excited she was, because this is kind of the season where people start to book all their vacations. And, we really enjoy helping people, plan trips and be able to have really unique experiences that they wouldn't have been able to have otherwise.
We have a couple questions about spending down resources. Does it have to be on medical necessities or quality of life items?
So not medical necessities necessarily. There are certainly rules about, that has to be for that person. It's not like they can just start spending it on anything. And there's generally a window of time that you have to spend down that money. So generally, you're supposed to, when you receive funds, you're supposed to get them out of your name before they become an excess resource in the next month. So if we're talking about somebody that's been holding resources for a long period of time, they may not be eligible to spend those down any longer. Or if they do, there's just that risk that, Medicaid could consider them to be ineligible during those months where they had not spent down those funds. Now, we certainly have had people do that in the past, where they put the funds into a special needs trust maybe much further after they were supposed to. A lot of the times agencies will work with you as long as they see proof that the funds were sheltered. They'll often, provide accommodations depending on your situation.
Sarah, can you confirm the date that the public health emergency will end? Someone wants to make sure they have the correct date.
Yeah, so it's a moving target. I don't know the exact date off the top of my head because it's been moved every quarter. Every quarter, they essentially extend it. And I believe the most recent extension was January. So in kind of March or April timeframe will be the next opportunity for them to extend it again. And what we've been told is that the federal government is required to tell states at least 60 days in advance. So once we get to a point where we're 60 days or less away from the end of the latest date, we're going to know that it's going to, likely going to get extended again. So as of right now, it is, I believe it was extended January 15th. So mid-March timeframe. And that's probably something too that you can Google or, research through the New York State Department of Health, and they should have that available. But just know that it's a moving target. So, it could very well be extended again. But the important thing is that what we're talking about today is it doesn't matter if it's extended again, because whether it's extended again or not, people are going to be required to recertify, because they have delinked the requirement of Medicaid eligibility from the public health emergency.
Yeah, we have a few comments saying that currently it is May 11th of this year, but like Sarah said, could be a moving target.
Yeah, it's possible it will be extended again. So.
We are at 12 o'clock. Do you want to keep taking some questions, or we can try to answer these questions after the fact? We can reach out individually.
Do we have a lot? I don't mind going a couple extra minutes, but I want to be respectful of everyone's time.
We have a couple. Some of them may be better answered individually. They're kind of specific. We do have a couple about the Medicaid buy-in program, if you can kind of explain that a little bit more.
Yeah, just what it is.
Yeah, just explain the Medicaid buy-in concept is the question.
Absolutely. So Medicaid buy-in is a program that is for individuals who have a qualifying disability, who are under age 65, and who work for a living. So they are receiving Medicaid services, but they want to be able to work. So it allows them to have more income and resources to enable them to go out, work a professional job, earn income, have some savings and assets, and still remain eligible for Medicaid services up until they're 65. So if you have someone who is, working a job and concerned about working too many hours where it could cause them to lose benefits, a buy-in program might be a good option for them that would allow them to have less anxiety and stress and allow them to work without fear of impacting their financial eligibility for Medicaid. And we seem to be getting a lot of questions about the buy-in program. So I'm wondering maybe we'll dive a little bit deeper into that in a future training.
Great. We do have a couple more questions. Some of them are asking about the income and resource limits for an individual, which we did share in the previous slide. So maybe we can throw that slide back up. Mm-hmm. And we're also happy to share a link to the DOH chart in the email that will come following the presentation. Yeah,
and it's linked here at the bottom of this slide. So this is the updated chart for the New York State Income and Resource Standards. The chart we sent in January was based on the 2022 federal poverty levels. This chart has now been updated to reflect the 2023 federal poverty levels, which is why you see that slight increase from what was initially published by the Department of Health in December of 2022.
If someone isn't certified disabled by Social Security, can they set up a trust account?
So an individual does need to have a qualifying disability under the Social Security Administration's definition. It doesn't necessarily mean that they are officially certified at this point. So you do just have to meet that definition. And then depending on, your situation, you need to document that either with your local Department of Social Services. For example, many older adults who need home care use pooled supplemental needs trusts in order to bring down their income so they can qualify financially for Medicaid to pay for those home care services. They don't consider themselves disabled. They're not certified disabled by Social Security Administration. But the types of things that go along with getting older, the types of chronic health conditions that they face, the need for assistance with activities of daily living generally qualify them to use this program. So there are steps you can take to be deemed disabled in order to use a trust. But you do generally need to have a qualifying disability under the Social Security definition.
For married couples, one receiving SSI and one working and not receiving SSI, and they have a joint bank account, is that a problem?
One is receiving SSI, the other is not?
Correct.
Okay. So, I mean, married couples are going to have a combined resource limit. The individual on SSI who's married is going to be able to have up to $3,000 in their name. And so if they are on a joint bank account, keep in mind that joint bank accounts, no matter how much money is in that account of that actual person's, all of that money will be considered theirs because their name is on it and they have access to it. So that could be a concern. Again, the married couples, her SSI eligibility should be based on their collective resources. So that could be a concern. I'd recommend looking into that further.
I believe this was answered already, and maybe just we might need the resource limit chart back on the screen. But if a Medicaid recipient is up to date on their spend down to a pooled trust, how much money are they allowed to have in savings?
So if they're up to date on their pooled trust and they're a single applicant, they can have up to $30,182 as of January 1st of this year. So if their assets are below that, they're all set. If they're above that, then they could be over the asset limit, need to spend down some funds. Prior to January of 2023, those asset limits were $16,800. So if they've had the resources in their name, prior to January, they would be subject to those asset limits in those months.
How would someone report assets deposited into the trust for the period where research weren't happening and the centers were closed?
So any deposits that you're making into a trust, you can get a report from the trustee verifying those deposits. So likely that is what the counties will be looking for, is an annual verification that the deposits have been made into the trust. And you simply contact the trust or the trustee and ask for that information. Give us the contact information of where it needs to go, and we can send that documentation directly to the local Department of Social Services or your managed long-term care plan, whatever agency is asking for that information.
Can I set up a trust fund if the person works and has a disability?
Yes. Yep. And it's just a question of whether they need it or not. Depending on, it really comes down to what benefits they're getting. I think we hear a lot that there's a lot of individuals who get SSI. They want to work, they want to be able to work more, but they have challenges because that puts them over the limits, to qualify for services. So this is, a great way to help them be able to work more. If they're on Medicaid only, and they want to be able to work more, they might be able to just utilize the Medicaid buy-in program and not need a trust at all because they have access to higher income limits and no longer higher assets. It used to be a little bit higher for the buy-in program. We're now the same. So just to be respectful of everybody's time, Nina, I think we're going to have to wrap for today, but we will, like we did in January, go through the Q&A and do our best to follow up on as many questions as we can. If you have a question that didn't get answered, please contact us directly. Some of these are anonymous. If you didn't provide us with contact information, we can't follow up with you. So please give us a call. We're happy to talk through specific scenarios. This is a big webinar where we're presenting to lots of people. If you would like to have more of an engaging discussion, reach out to us. We are happy to present an in-service training to you and your team to help you guys navigate these situations and just review what options may be available to somebody. We really want people to just consider all of the options available to them and choose what is the best fit based on their individual needs. We thank you guys so much for joining today, and we look forward to hopefully seeing you guys again later this year. Please do contact us if you have additional questions.